everybody, and welcome to Includes Podcast presented by Proximal Solutions. Before we go into our episode today, there is something that I really need to share with you guys, because if you don't know, you need to know. So if you have not heard about Anchor, guys, it is the easiest way to make a podcast. And I said it is the easiest way because number one, it is free. Yes, it is free. There are also creation tools that are going to allow you to record and edit your podcast right from your phone or your computer. It does not get any easier than that. But wait, there is more. Anchor is also going to distribute your podcast for you so that it can be heard on Spotify, Apple Podcasts, and more. You can even make money from your podcast with no minimum listenership. It is everything really that you need to make a podcast, and it is all in one place. So do me a favor, go in, download the free Anchor app, or go to anchor.fm to get started. Hello. Thank you so much for tuning in into another episode of Proximal Includes Podcast. I am your host, Marlegny Mourino, and I'm so excited to be here with you today for another episode, another month. In the last two episodes, what we discussed were the ICD-10 CM changes for 2021, which took effect this year, 2020, okay? But in this episode, what I have in store for each and every one of you is what? You probably guessed it right. The CPT, or Current Procedural Terminology Coding Book, changes for 2021, which those do take effect January 2021. So what is CPT? Let's start from the basics. CPT is our medical code set that we use to report for medical, surgical, and diagnostic procedures and services. So in other words, these are the codes that we use, physicians, allied health professionals, non-physician practitioners, hospitals, outpatient facilities, and laboratories to describe the procedures and services that they perform for to federal and private payers for reimbursement of these services. Okay. In 1966, the AMA, or the American Medical Association, created CPT, the CPT codes, as a way to standardize reporting of medical, surgical, and diagnostic services and procedures that are performed in both inpatient and outpatient settings. Each CPT code represents a written description of the procedure or service, which, eliminates the subjective interpretation of precisely what was provided to the patient. But given the massive number of services and procedures, the AMA, or the American Medical Association, organized CPT into three categories. Okay, three categories. So we have category 1. This is the largest set of our codes in our book. They consist of the commonly used codes for providers to report their services and procedures. These codes are all numeric, so there are no letters with these codes. And for category 1, this is where we have our evaluation and management service codes, code range 99201 to 99499. Our anesthesia services code, our code range 01000 through 01999. Our surgery codes, the largest section in our category 1, because this is then farther broken down into body systems, where you can have surgery from head to toe. So our code range for surgery is 10021 to 69990. We also have radiological services, or radiology services, 70010 to 79999. Our path and lab, or pathology and laboratory services, code range 80047 to 89398. And also our medicine services, or medical service and procedures, code range 90281 to 99607. This is all Category 1 codes. Then we also have our Category 2 codes, and these codes differ because they actually end on a letter. They end with the letter F, and these are the F as in Frank, okay? And these are for supplemental tracking codes that are used for performance management. So for example, providers would use Category 2 codes to track specific information about the patient, such as, whether or not they use tobacco, for example. And this is to help them deliver better healthcare and achieve better outcomes for their patients. In our Category 2 codes, you're going to see a code range for composite measures, another code range for patient management, patient history, physical examination, diagnostic screening procedures, processes or result, not procedure, processes, therapeutic, preventive, and other interventions, follow-up and other outcomes, patient safety, structural measures, and non-measure code listing was the last section there on our Category 2 codes. Then we have our Category 3 codes. These also end with a letter. They end with letter T. T as in Tom, T as in tomato. This is for temporary, so let's tell people T for temporary. For temporary codes used to report emerging and experimental services and procedures. So temporary codes describing new services and procedures can remain in Category 3 code for up to 5 years. So the codes can be there for up to 5 years. If the services and procedures they represent meet Category 1 criteria, which means that it includes FDA approval, evidence that many providers perform the procedure, and evidence that the procedure has proven to be effective, then they would become a Category 1, or Category 1 code will be assigned for it. On the other hand, Category 3 codes can be eliminated if providers do not use them. So once again, in our CPT book, we have 3 categories. Category 1, all numbers. Category 3, ending with letter F. Category 2, ending with letter F. And then Category 3, ending with letter T as in tomato. To accommodate the evolving world of healthcare and to include just, availability for new services and also any outdated procedure, the AMA updates the CPT code set every year. So they release new, revised, and deleted codes, as well as changes to the CPT coding guidance as well, the guidelines. So what are the changes for 2021, you might ask? Well, I'm so glad you asked. According to the AMA, or the American Medical Association, their press release from September 1st, 2020 of this year, the CPT code set continues to, this is what they said, the CPT code set continues to see growth in new and novel areas of medicine, with the majority, 63% of new codes this year involving new technology series described in Category 3 CPT codes, and the continued expansion of proprietary laboratory analysis, or PLA for short, section of the CPT code set. So once again, this is straight from the AMA press release from September 1st, 2020. So the changes to CPT for 2021 include 329 editorial changes. 329. So what does that mean? That means that we have 206 new codes. We have 69 revised code descriptors, and we have 54 deleted codes. So once again, 206 new codes. You add 69 revised code descriptors, and then to that you add 54 deleted codes. You have what? A total of 329. So those were the 329 editorial changes that are happening or that are coming for 2021. So let's take a little bit of a closer look at these changes. So per AMA, among this year's important additions to the CPT code set are a new medical testing services sparked by the public health response to the COVID-19 pandemic. The CPT code set has been modified with several codes additions and revisions that have been approved for immediate use and published for the 2021 CPT code set. This is also from their press release. The CPT code set also includes new codes for retinal imaging and external extended electrocardiogram monitoring or ECG monitoring. We had an addition in retinal imaging with automated point of care, which is code 92229 for retinal imaging with automated point of care. Once again, code 92229, and to better support the screening of patients for diabetic retinopathy and increase early detection and incorporation of findings into diabetes care, we also have revisions for two more codes, which are 92227 and code 92228. Okay. Technological advances in the field of continuous cardiac monitoring and detection prompted the addition of more codes, which are 93241, 242, 243, 244, 246, 247, and 248. That was code range 93241 to 93248. And this is also along with associated guideline revisions for those codes. Those codes will replace category 3 codes that are or were or will be 0295T, T is a temporary code, 0296T, 0297T, and 0298T. So it replaced 1, 2, 3, 4 codes that were deleted, and now we have 4, 5, 6, 7, 8 code that replace those codes. Several new codes that were implemented also earlier this year because of the COVID-19 public health emergency are debuting, or I think that is the correct word. They're coming out in our 2021 CPT code set. They're making it debut. Guys, you know, my English, you guys know, it's not my first language. If I ever say anything that you do not understand, please let me know, and I would either pronounce it differently or find a different word that I can use to say the same thing. Okay, so those codes that were implemented earlier this year, they included 87635. This one was effective back in March 13. 86328, effective April 10th. Also effective April 10th, we had 86769, and effective May 20th, we had 0202U, the letter U at the end. Okay, and those were because of the COVID-19 public health emergency. CPT 2021 includes several new category 1 codes for pathology and laboratory, and also for the medicine section of our CPT book. There are also many new category 3 codes, including those for computed tomography of the breast, including 3D rendering. CPT 2021 includes many revised, listen to this guys, revised E&M codes, and also the deletion of 99201. Our office visit, new patient, level 1 has been deleted. 99201. Other E&M revisions were made for the following codes and sections. So for office and other outpatient, for our new patient, code range 99202 to 99205, we had some revisions. For office and other outpatient, for established, our code range 99211 to 99215. Prolonged services in the outpatient setting, codes 99354 and 99355. Prolonged services in the inpatient or observation setting, code 99356. Prolonged clinical staff service, codes 99415 and 99416. Complex chronic care management services, codes 99487 and 99489. And also code 99490 for chronic care management services. So a lot of changes for our E&M section. So guys, to recap, the AMA has made 329 changes to the 2021 CPT code set. That includes 206 new codes, 54 deletions, 69 revisions that will take effect January 1st, 2021. The AMA added CPT codes that related to the COVID-19 pandemic that were approved for immediate use and published in the 2021 code set. We have 8 new codes that were added to improve documentation for continuous cardiac monitoring and detection. And those codes are going to be, those were the 8 codes that replaced the 4 codes that were deleted. There are new and revised CPT codes to enhance screening and care of patients with diabetes. Among the changes in the 2021 NCPT codes and guidelines for office and other outpatient, this is our evaluation and management services, the AMA said it is the first major overhaul in more than 25 years. I'm going to say that one more time. The AMA said it is the first major overhaul in more than 25 years to the E&M office visit coding and documentation. First major overhaul in more than 25 years. Amazing. So we have a lot of changes that are coming. I've always said, guys, the best way to prepare for any changes or prepare for anything that's coming is to learn more about the changes, and also how are these changes are going to affect our practices, our providers, our coders, and our reimbursement. As always, this is a partnership. You can always reach me with any questions you might have, or if you need me to elaborate a little bit more on these changes, or even to provide you with more resources, guys. There's a ton of information out there, but we need to make sure that we are discerning what's correct, what's accurate, what's not accurate. Because, just because there's a lot of information out there does not mean that all the information that's out there is 100% accurately. So you can also review. I'd always leave you with my resources and my references that I use for every single one of my episodes in the description, so you can review those to get more information, or once again, reach out to me. Let me know if you have questions. Let me know how I can help you. But in the meantime, I will catch you on my next episode. Thank you all so much for listening, and I hope you have a blessed day. I will catch you once again in the next episode. Bye, guys.